This video will explain the broad idea of the new pod system way of working, which will be trialled in the emergency department. The aim of the trial and of this system is to improve both patient and staff experience and to ensure that all patients are seen as quickly as possible. This is the current structure of the department. Resus, HD and IC, green zone and triage, the reception and the waiting room, and the area outside Resus which is currently unused. Patients can go from here into the minor injuries unit. Self-presenting patients enter through this direction, and patients coming in with the ambulance service arrive in this direction, although this will shortly change to this direction. This area in HDIC will become Pod A and will have 8 cubicles. This area in IC will become Pod B and will have 9 cubicles. This area, including parts of triage, green zone, the isolation room and observation cubicle, will become Pod C. It will have 8 cubicles and the observation cubicle. Cubicle C1 will become self-presenter triage. This area of triage will become Pod D and will have 7 cubicles. So our department will now look like this. Resus will become the Resus pod. HD and IC will become Pod A and Pod B. Green zone and triage will become Pod C and Pod D, with self-presenter triage included. Each pod will be staffed by 3 nurses, 1 CSW, a number of junior doctors or nurse practitioners, and a senior doctor such as a consultant or registrar. It will also be supported by floating members of staff. Pods A and Pod C will be the primary pods and will be open all of the time. Pod B will be opened as demand requires. Pod D will be used for expected patients, including medical interface patients. When only pods A and C are in use, they may flex into the adjacent pods. Pod A will flex into Pod B, and Pod C will flex into Pod D. If patients require to stay in the emergency department due to unavailability of beds in AMU or the ARC overnight, then Pod D will be used. This will ensure space in the other pods is maintained, and it is anticipated that these patients will get beds before the bulk of the expected patients arrive the next day. This is the Bernadette nurse. Say hello to the Bernadette nurse. There will be 2 Bernadette nurses who will perform rapid triage. 1 Bernadette nurse for self-presenters in cubicle C1 and 1 Bernadette nurse for ambulance patients in the area outside of Resus. At self-presenter triage, after booking in, the patient will be received by the Bernadette nurse, who will take a very brief history and assign a triage category on track. If the patient is suitable for redirection, then tasks such as News 2, ECG or urinalysis may be performed at this point. The patient will then be sent to one of the following: the Resus pod, pods A through D, or will be redirected to an appropriate service, including the minor injuries unit. The aim is that all patients are triaged within 15 minutes, and that no patients will remain in this area for more than 30 minutes. Ambulance triage patients will arrive and be assigned a triage category on track. News 2, pain scores and the clinical history should have been generated by the ambulance service. These patients will either go to the Resus pod or pods A through D. The self-presenter Bernadette nurse will be supported by a CSW and by the pod support nurse, which is the former flow role. The ambulance Bernadette nurse will be supported by the portering team. Patient journeys will now look like this. Patients will self-present to reception, and after booking in will be directed to the self-presented triage cubicle. The Bernadette nurse will perform their tasks and assign a triage category. They will direct the CSW to take the patient to a pod of their choosing based on current pod busyness and acuity. The pod support nurse will support this process. In the pod, the patient will be received directly into a cubicle. Pods will need to keep 2 cubicles empty at all times to achieve this. The patient will be received by a nurse and a care provider, with oversight from the senior doctor. This is similar to how we currently receive patients into resus. The CSW will hand over the patient and return to triage. At this stage, initial investigations will be ordered, including X-rays and advanced radiology, ECGs and bloods. A bed may be requested at this stage if admission is inevitable, and initial treatments will be started. The receiving care provider will also be the assigned care provider for this patient. Ambulance patients will be presented to the Bernadette nurse in the area outside resus and directed to a pod after triage using the same process as self-presenters. Following full assessment in a pod, a patient may be discharged home, admitted, sent to the short stay observation unit, or a specialty review may be requested. Each pod will be expected to undertake mini safety pauses. The purpose is for all team members to highlight any concerns or outstanding tasks, to review ongoing care and requirements, and to ensure the well-being of all team members. The pod support nurse will attend each pause to help action any issues and to feed back to the departmental pauses. This entire process is new and will naturally evolve. We are sure that you have many questions. Some will be addressed in the accompanying written guide, but please also take the opportunity to attend the Friday drop-in sessions or to ask your line manager or any members of the project team. Your feedback and ideas will be invaluable, so we do welcome absolutely everything. Thank you.